The goal is always to use the fewest number of stitches possible to close the wound without tension on the wound edges. Since it's hard to guess how many stitches will be necessary just by looking at the wound, it's best to place the first stitch in the middle, dividing the laceration in half. Then 2 more stitches are placed in the middle of these halves, and this process is continued until the wound is completely closed. That's why if done properly, an odd number of stitches is usually needed to close most linear lacerations. And if you guessed 15 simple interrupted stitches for this wound, you were right. Attempting to close the same laceration going from one side to the other will most certainly require more stitches. This is because of the more uneven distribution of tension. It makes you want to put the sutures closer together just so you don't have to redo them if they're too far apart. And the number of sutures required varies with the amount of tension on the wound. So wounds under more tension will require more stitches even if they are the same length. To further minimize the number of stitches required, we can use tension relieving mattress sutures, which are more appropriate for high tension wounds. Get yourself one of these Suture Buddy pads and start practicing.